Hi everyone, my name is Aisha Jawed. Welcome to this online session on an introductory overview to clinical writing. Before we begin, pause this session and jot down your fears about writing in the clinical style. What have you been struggling with so far? And what do you anticipate struggling with the most? Throughout this session, we are going to gain familiarity with the form, style, and purpose of clinical writing, determine the key components of effective clinical notes, identify objective, concise, and goal-oriented writing, and learn to craft clear clinical goals that are measurable. I encourage you to jot down notes as we actively discuss each objective. Clinical writing helps to keep a summarized record of pertinent information about the case, as well as interventions and progress to help support the patient or client globally to meet treatment goals. As a side note, the terms patient and client are interchangeable, and you can use either based on your preference. Clinical writing also delineates history and assessment of the case, generally followed by treatment goals and plan of care that is prescribed by the clinician. And also, from a legal perspective, clinical writing is documentation that provides objective information for liability purposes to anticipate situations where the patient or the client may take legal action pertaining to any part of the assessment or the treatment plan. When writing clinically, develop the mindset that the patient or the client is right beside you, reading what you are writing at all times. This will help in many ways, but primarily by helping you stay on track with writing objectively and thinking carefully about what you are writing. And it will also encourage you to give thoughtful consideration to whether the plan of care or the assessment or progress note reflects an accurate representation of the case or the patient globally. In notes that contain information about the initial diagnosis, always include a differential diagnosis backdrop, starting from broader and narrowing to more specific, to ultimately guide and inform how you came up with your diagnosis. This can be done by describing symptoms of your patient that align or correspond more with a particular diagnosis or more than one diagnosis if you identify comorbidity from your assessment. And also by outlining relevant family history, previous psychiatric history, and social history. Begin with a general overview of the case by condensing pertinent information into one or a couple sentences, or one paragraph at the most, to summarize the highlights of the case. Your clinical notes should always be descriptive, but back up your assessment with examples of symptoms, events, or statements that your patient has made to enhance the clarity and objectivity with better understanding the case. And always include a summary of the case, assessment, treatment goals, and plan of care, and plan for follow-up in your clinical notes. When creating treatment goals, always make your treatment goals measurable. Provide examples and specify an estimated time frame to meet or achieve each goal. For example, through client-centered therapy, or narrative therapy, or role play, or mindful activities using cognitive behavioral therapy. Now let's review an example of an effective treatment goal. Patient will engage in short-term cognitive behavioral therapy for the next 3 months to treat his depression related to several recent life stressors by challenging his self-defeating thoughts to enhance his self-efficacy and empower him to regain emotional control of his life. So in this example, we have a treatment goal that is measurable. We have an estimated time frame over the next 3 months. We know that the goal is to treat his depression, and we have specific examples of how his treatment will be measured through challenging his self-defeating thoughts, using cognitive behavioral therapy to help empower him to regain control of his life. So to summarize, consolidate clinical information by considering whether each aspect of the case is significant to the clinical picture globally. Include history from your interview with the patient and summarize the patient's presenting symptoms, family history, previous psychiatric history, and social history into organized separate sections containing pertinent information. And keep information as objective as possible for potential legal implications. Okay, so now we're going to take some time to review the key components of an effective clinical note, beginning with the overview section. So the patient is a 6-year-old boy who presents with symptoms of stress, anxiety, and withdrawn behaviors at school, likely secondary to recent stressors at home that include his father's incarceration, mother's job loss, and looming eviction. So this overview section is a one-liner that identifies who is the patient, what brought him in, and possible causes of his symptoms. So in general, based on the wealth of history obtained in your interview with the patient, the overview section can be a couple sentences to a paragraph as well. Family history. Father has a substance use history and is in liver failure. Mother has depression and bipolar I disorder and is an active smoker. Psychiatric history. Mother was hospitalized in an inpatient psychiatric facility before the patient was born for a suicide attempt following death of the patient's maternal grandmother. And social history. Patient lives with mother, twin sister, and 6-month-old brother in a 1-bedroom apartment. Okay, now we're going to review the assessment note, the assessment section in this specific clinical note. So the first sentence begins with, patient is a 6-year-old boy presenting with stress, anxiety, and behavior issues at school, with onset of symptoms beginning around 3 weeks ago, likely secondary to recent stressors at home. So in some ways, this first sentence is very important, and it's similar to the overview section of this note, since it describes the patient's symptoms and when they began, and discusses possible causes of these presenting symptoms. So he is able to engage in conversation with this clinician, but does appear withdrawn. He has been struggling with his father's absence over the past couple of weeks. So these two sentences describe the patient's affect, that he's withdrawn and that he has been struggling. After his father was incarcerated, financial responsibility has fallen on his mother. Since his infant brother has also been sick, she has not been able to work and has lost her job, which has created financial strain for the family, especially since they may now lose their home. Patient has been struggling with these concurrent stressors at home and school. He does not have significant conduct issues at school and has primarily been withdrawing from participating with his peers in class activities and assignments. He has been feeling anxious about whether their family will have a home once he leaves school each day. He is also scared about his mother's sadness and anger after she lost her job. So these several sentences provide specific examples of the patient's current stressors that he's experiencing at home and school, which could significantly be contributing to his presenting symptoms. Okay, so now the last sentence of the assessment note, or the assessment section of this note, is also very important. In some ways, could be more important than the first sentence. Given these stressors and presenting symptoms, he likely has a diagnosis of adjustment disorder with mixed anxiety and depressed mood. So this last sentence presents an analysis of how the constellation of the patient's presenting symptoms and stressors formulate this specific diagnosis. So treatment goals and plan of care. So all of these treatment goals are going to be measurable. We'll have a specified time frame for the patient to meet or achieve each goal, and we'll have examples of how the patient will address each goal. So the goals are that patient will engage in play therapy with the clinician to work through his feelings of sadness and anxiety from his father's absence over the next 6 months. Second goal is that the patient will express his feelings of emotional distress and anxiety about current circumstances at home through client-centered therapy with the clinician and through narrative therapy by journaling over the next 6 months. And the third goal is that the patient will meet with clinician and mother once every other week over the next 6 months to give patient protected time to share and process with his mother how recent changes have impacted their family in the presence of the clinician as a facilitator. Generally, you can write about 2 to 3 treatment goals and always back up each goal with examples of how you're going to address each goal with the patient. In most cases, we conclude each clinical note with examples of how each goal will continue to be addressed with a plan for follow-up. So in this specific clinical note, we have 3 goals for follow-up. The first one is that the patient will be engaging in physical activity with his peers after school at least twice a week over the next month. The patient will be following up with the clinician in therapy next week. And patient will visit with his father in jail later this week. So these goals generally have some kind of prescribed time frame included as well. So now that we've finished reading this note, just wanted to remind you that it's a hypothetical clinical example of an intake for a child pediatric patient to obtain history, complete a comprehensive psychosocial assessment, and formulate a prescribed, measurable, realistic treatment plan for this patient. Okay, so now let's take a moment to pause this session and jot down your responses to the following questions. Identify the pertinent information in the overview section. Describe the nature of content presented in the assessment section. Are the treatment goals measurable? Also, take another moment to pause this session and write a goal that you have for yourself in terms of clinical writing. What would you like to work on to first grow as a writer in a wide range of clinical settings? How do your goals connect to your fears at the beginning of the session? Were any of your fears alleviated throughout the session? If yes, give us some examples. Thank you very much for joining us on this online session for clinical writing. I hope you have learned a lot, and good luck with your internships and externships during the upcoming school year.